Yeah,
Four eyes are better than two.
Yeah, that liquid
All right.
is that's all liquid right
You're
there.
gonna get that, put it in there.
We're gonna put the
1
exosomes
ml.
into the immune
I mean, it
boosting
was fine,
IV bag.
you know, honestly,
which
I
is
felt like I was
filled
being
of
sucked down
25,000
into a blender
milligrams
at like really,
vitamin
really low
C.
speed. And then that had a
I know,
stroke.
I
He
heard
got
a
this in with a
stroke,
stroke. And you know, like they couldn't find, I mean, you know, residually he didn't have any infarcts in his
Yeah.
brain, but he was left, you know, like hemiplegic. And he, but so it was just basically from inflammation because there was no infarct, you know, that he was left with, and they gave him an infusion. He said within like 20 minutes he started to move one of his toes or to have a little sensation, and then within a few days he was able to like move his foot a little bit, and now he's walking. This is years later now.
Yeah, but still.
And it was the inflammation, and you know, once you have like the brain inflammation, like it just doesn't really go away.
But that's why I think that would be really good for TBI, traumatic brain
I think
injury.
so.
That's exactly what
And all
we
of
were
those things.
Yeah,
And
And
yeah.
I'd love for us to develop some kind of a TBI
We're doing it.
program.
Yeah.
We have a
The
patient.
CMEX, celiac, that's one. But
That
imagine
kid.
if we can advertise for this eventually.
That kid. Well, he's gonna be our first,
Yeah.
right?
Again, post-COVID, again, man, like that tyrosine. Are you seeing a lot of post-COVID, those long holidays?
Not really.
I get a good amount of them.
No,
I
you know,
know.
our biggest hurdle is that people get sick, wait to get sick, and then they're like, give it to me right now. Okay, I need a blood test. You need to have a consultation. Like, you know what I'm saying? So it's like people need to do this
LDN
preventive.
would be good for that.
Which one?
Like LDN.
LDN. So I find you
You
order
love
some
LDN, huh?
Well, I love the theory of it.
Oh, you
I
haven't been
haven't
using
started
it?
taking it, so I just
So bad.
ordered some 1 milligram
Oh,
tablets.
what's
I'm
up?
going to try it.
Do you have a
What
pedal?
response have you gotten from
A
your
pedal?
patients?
Oh, it's amazing.
He
So
looks like
I
he's
have
gonna
been
be
on it
uncomfortable.